We begin tonight with breaking news. The coronavirus is now in Connecticut. Just hours ago, Governor Ned Lamont made the announcement, and here's what we know right now. The patient is a person from the town of Wilton in Fairfield County between the ages of 40 and 50 years old. He or she is currently being treated at Danbury Hospital, and officials tell Eyewitness News they believe the infection happened during a recent trip to California. Channel 3 Eyewitness News reporter Matthew Campbell joins us live now from the state lab in Rocky Hill, where more testing is happening right now. Matthew, do officials think there could be more patients than just this one?
Patricia, yes, they do, and right now only time will tell. So last night, 9 tests were being done. We got the results of 1, and that did come back positive. It is this Wilton patient. So 8 tests remain here at this lab, and who knows how many of those will be testing positive. But this is what we know right now. The state is doing what they're calling extensive contact tracing. They're trying to find all the people that this person came into contact with, all while this patient gets treated at Danbury Hospital. Again, officials believe this patient got the virus in California, but officials say there's no reliable information on where in California or what he or she was doing. It's also important to note that this case is not connected to the developments on Friday or Saturday, where 2 people who are employees of Danbury, Norwalk, and Bridgeport hospitals tested positive. Again, this case is not connected to those. Both of those patients live in Westchester County, New York, a place that's seen so many confirmed cases. New York's governor declared a state of emergency yesterday. And remember, Westchester neighbors Fairfield County here in Connecticut. So Governor Lamont, who was very visible for the last 2 days, he declined to go on camera or do an interview with us today. But Senator Blumenthal was very vocal, and he says this will get worse.
The numbers are likely to increase, in fact, soar. Connecticut's likely to be a hotspot, a source of soaring numbers, in part because the federal government has delayed in lagging and lacking efforts to provide the tests that are needed to know the reality of facts on the ground. How many people have been infected? We really have no idea about the scope right now.
So again, the state sees its first confirmed case of the coronavirus. And based on what you just heard, it suggests that there could be more that we do not know about. Again, 8 tests are currently at this lab being done. Meanwhile, this week we are expected to see more test kits come into the state, and also private testing is also expected to begin this week. Patricia.
So, Matthew, the Wilton patient is being treated while a group of people he had in contact with are now in self-quarantine. So what do people who were in contact with that group now need to do?
Well, Patricia, according to the state, they need to do nothing because a contact of a contact, they say, is low risk, especially if that person is not exhibiting symptoms. Patricia.